Chapter 4 is laboratory operations. 451. The government agency of the United States responsible for regulating the safety and health of workers is OSHA. 452. The agency that developed a label designed to communicate specific hazards associated with hazardous chemicals is NFPA. So remember NFPA means National Fire Protection Agency. And remember, OSHA is, what's OSHA again? Occupational Safety Hazard Association, something like that. 453. According to NFPA, which of the following classes of fires occurs with ordinarily combustibles? Fire A. 454. According to the NFPA, which of the following classes of fires occurs with flammable liquids and vapors? Class B. Remember, A is for ordinary combustible. Remember, B is flammable liquid. .455. According to the NFPA, which of the following classes of fires occurs with electrical equipment? C. .456. According to the NFPA, which of the following classes of fires occurs with combustible or reactive metals? Class D. .457. What is the NFP agency's code word for action in the event of a fire? RACE. R-A-C-E. How RACE to go again? RACE is what? Rescue. I don't remember, but it's RACE. I think it means rescue the person closest to you. What is that? Wow, 11:11. Anyway, 458. Which of the following mnemonics communicates the appropriate procedure to follow when using a fire extinguisher? Pass. So pull, aim, spray and sweep, something like that. So remember, the race is in case there's an event of fire, the action you should take. And pass is the procedure when using the fire extinguisher. 459. Which of the following fire extinguisher contents is appropriate to use on a Class A fire? So remember what Class A fire is? Class A fire is ordinary combustible. So the following fire extinguisher contents, which of the following fire extinguisher contents is appropriate to use on Class A fire? D, which is pressurized water. .460. What are the contents of a multi-purpose ABC fire extinguisher? And the answer is dry chemical. That's the content. So that could be used on Class A, B, or C. .461. If a specimen tube containing patient blood breaks in a centrifuge, what is the first thing the phlebotomist should do? Unplug the centrifuge. .462. What are the three components of radiation safety? Time, shielding, and distance. .463. Labeling of hazardous materials is required by which government company? Remember, anything to do with safety is OSHA. So it's OSHA's Hazardous Communication Standard. And labeling is communication, and hazard have to be there, and that's the standard. .464. A form provided by chemical manufacturers containing general information, safe handling, and emergency information regarding a particular chemical is called a MSDS, which is Material Safety Data Sheet. .465. An agency that establishes standards for the operation of hospitals and other healthcare agencies conducts surveys and accredits programs that meet the defined standards is JCAHO. So that's JCAHO. I think that means Joint Commission Association Healthcare Occupation, something. It's JCAHO, JCAHO. .466. I'll look all that up when I'm done. 466. Appropriately maintaining a centrifuge is an example of what kind of safety? Mechanical. 467. Which of the following activities should never occur in the laboratory? Eating. 468. A factor causing emotional or mental strain or tension is called stress. .469. A patient suffering from disease or injury to the central nervous system would most likely be admitted to the neurological unit. Remember, anything to do with the nervous system is the neurotransmitter, so it's the neurological unit. 470. A patient suffering from a mental or an emotional disorder would most likely be admitted to the, remember, anything to do with mental emotional is your psyche. So the psychiatric unit. 471. A patient experiencing complications related to pregnancy would most likely be admitted to the obstetrical unit. So remember, obstetric and gynecology. Obstetric is pregnancy. So look it up anyway. 472. The field of medicine that specializes in diagnosis and treatment of the elderly population is called what? Geriatric. Or geriatric. 473. The field of medicine that deals with the diagnosis and treatment of joint and tissue diseases is rheumatology. Remember, like rheumatoid arthritis? Rheumatology is joint and tissue. Look up what rheuma means. It's the study of, so look it up. The suffix. What's that? Prefix? Is that a prefix or that's a root? We'll look it up. 474. The medical specialty that deals with the diagnosis and treatment of disorders of the eye is, remember, eye is up. So it's the ophthalmology. Look that up too. 475. The field of medicine that deals with the diagnosis and treatment of disease of the ear, nose, and throat is otolaryngology. So remember, larynx is the throat. We need to look this up too, prefix. 476. The Department of Medicine that specializes in the diagnosis and treatment of disorders associated with male sexual and reproductive system and renal system for both sexes is, remember, renal means bladder, it's the urology. 477. The medical department that specializes in the diagnosis and treatment of disorders associated with the esophagus, stomach, and intestine is gastroenterology. Look that up too. You know, anything with gastro is the stomach though. Look it up anyway. 478. The medical department that specializes in the treatment of disorders associated with hormone production is, we know hormone is from the endocrine system, so it's going to be the endocrinology. $479. The department that uses radioactive materials to diagnose, treat, and monitor disease processes is, uses radioactive material to diagnose and treat and monitor disease process. Okay, so that's the nuclear medicine, because you know a disease starts from within the nucleus of the cell. That's what's damaged when there's a disease. So that's what nuclear medicine. Look up anyway. 480. The department that assists patients in becoming as independently active as possible, given the limitations of their physical or mental problem is, yes, occupational therapy. 481. The department that works with the patient to eliminate his or her disability or to restore mental or physical abilities lost as a result of illness or accident is, you know, that's a physical therapy. $482. A physician who specializes in the diagnosis of disease from laboratory test result is a pathology. Because remember, when you get a disease, it's kind of like pathogen. I'm gonna look it up anyway. 483. A laboratory professional who enters the field after obtaining a bachelor's degree, including a year or more of study in medical technology, is a medical technologist. It's right there. So that's a laboratory professional. Okay, so 484, a laboratory professional who enters the field after obtaining an associate degree in a laboratory professional enters the field after obtaining an associate degree is a medical laboratory technician. So it's not the medical technologist. He's a medical laboratory technician. So he's the one that kind of do the labs, but the medical technologists read the labs. So one kind of do it but can't give the results. 485, a laboratory professional trained in all aspects of blood specimen collection and transport is a, oh shit, it's me, phlebotomist. Trained in all aspects of blood specimen collection and transport is a phlebotomist. Well then, I'm a laboratory professional. 486. A laboratory professional who is responsible for the administration of a particular section of the laboratory is a technical supervisor. So that's like admin. Like administration they're the one. Like the Food and Drug Administration, they're the one that supervise how much drug you put in the food. So that's like this technical supervisor. 487. A technologist with an advanced degree and several years experience who is responsible for overseeing all operations involving physician and patient service is a what? Is an administrative technologist. So he's responsible for seeing everything that goes on. He's the one that makes sure everything is going good. 488. What is the highest administrative position on a standard organizational chart for the clinical laboratory? The highest position in the standard organizational chart for clinical laboratory is administrative technologist. 489. The rupturing or destruction of red blood cells resulting in the release of hemoglobin into the fluid portion of the blood is called hemolysis. .490. The disease state resulting from the invasion of the body by a pathogenic microorganism is called infection. Anything that invades you infects you. 491. An infection acquired in a healthcare facility is called nosocomial. 492. An infection control program that includes monitoring specific patient populational groups and classifications of infection is called surveillance. 493. The three components of the chain of infection are source, mode of transmission, and susceptible host. So where it come from and how it got transmitted and who it got transmitted to, that's what that means. 494. An infection that can be transmitted from one person to another is called communicable. 495. The term used to communicate an organism's capability of living is viability. 496. The ability to overcome the defense mechanisms of the host is an organism's what? The ability to overcome the defense mechanism of the host is an organism's virulence. 497. Salmonella organisms are examples of what component of the chain of infection? Source. 498. Which of the following is an example of a mode of transmission in the chain of infection? It's a bunch of examples here, but the answer is venipuncture needle. 499. Which of the following is an example of a susceptible host in the chain of infection? And the answer is patient afflicted with AIDS, because remember, their immune system is low. 500. Human hands are examples of which component of the chain of infection? Source. Like how he got infected. What's this? So his hands was dirty, like that. 501. Airborne droplets are example of which component of the chain of infection? Mode of transmission. 502. A patient undergoing immunosuppressive therapy prior to transplant is an example of which component of the chain of infection? Susceptible host. 503. Which of the following agencies first recommended universal precautions? The CDC, so that's Center of Disease Prevention and Control. 504. Universal precautions prevent the spread of which of the following pathogens? It's a bunch of answers here, but the right one is bloodborne. It's universal, so you always think someone have a deadly disease. That we treat everyone the same way. 505. The term bloodborne pathogens most commonly refers to what? HBV and HIV, because those things is transport via blood. 506. Under universal precaution, which patients are considered potentially infectious? Is it patient infected with HBV or patient infected with HIV? It's both, because they're bloodborne. Next one, 507. A synonym for the term barrier protection as it applies to bloodborne pathogens is PPE. So personal protective equipment is considered a barrier protection. So it's a barrier that protects you from the bloodborne. Okay, 508. Which of the following PPE is required if splashing of blood and body fluids is likely? Mask. Remember, the blood and those fluid could get in your nose and your eyes, and it transfer quicker that way. So 509. Which of the following practices is prohibited under universal precautions? The answer is recapping needles. 510. Under universal precautions, when should a phlebotomist change gloves? After every patient. 511. Under universal precautions, when should a phlebotomist wash his or her hands? After every patient once gloves are removed.